And joining me now is Dr. Sita Patel. She is a licensed clinical psychologist as an associate professor of psychology at Palo Alto University. Thanks so much for being here.
Thank you for having me.
So mental health is something that we're hearing more and more people talk about, either celebrities and athletes talking about their own struggles. We're hearing people talk about it on social media. It's not the taboo topic that it was, say, 5 years ago, but yet we're still struggling to find people who can help with mental health struggles. Why do you think that is?
I think there's a number of things happening. One, the communities that are comfortable talking about mental health don't encompass all communities in the Bay Area or in California. So there are still a lot of communities, immigrant refugee populations, for example, or those for whom stigma around many different health concerns, but mental health in particular, is still quite high. So we don't see a universal, I think, reduction in stigma. And then relatedly, there aren't enough specialty services that address the needs of specific populations. So there might be general services available, but if you have specific kinds of diagnoses or life experiences or identities even, you might need to have somebody with that kind of specialized training or exposure.
Now, we mentioned more and more people are talking about mental health issues, but do you think the rates of people experiencing mental health crisis or issues of their own, do you think that they're actually going up, or do you think that more people are just recognizing that they have a problem and before they didn't really have the information to identify that?
I think it's both.
Okay.
So I think we are seeing now really clear research that all of what happened with the pandemic, school shutdowns, people being isolated at home, kids having huge gaps in their education, their socialization, that's having a really clear now direct link to anxiety and depression and mental health symptoms. So we definitely see that. And then I think on top of that, there just aren't enough providers to provide the services to all of those who need it. So yes, people are more comfortable talking about mental health, but there isn't enough in terms of how many people are available to provide services.
So what's being done to help encourage people to seek professions in the mental health field?
Yeah, well, I think, California is giving a lot more resources toward mental health training, so that's wonderful. I work at Palo Alto University. We have a number of programs, one of which is a new program, Master's in Social Work, and it just received a California grant to develop a program specifically for increasing capacity in California. So the topics, the laws, the licensure is all really tailored to California. And we're a university that's been around for 50 years and focused on behavioral health. But I think we still need more resources in terms of scholarship funding so that people can pursue education that sometimes takes 2, 3, 4, 5 years. And I think that's a real barrier. So for people to be able to pause the rest of their life and devote time to an education like an extensive psychology training is sometimes difficult. So I think more creative programs where people can, do things online, get their education during off work hours and times that are more accessible will really help.
You mentioned the pandemic earlier, and I'm curious how big of an effect that's going to have on generations to come, and if there's going to be a trickle-down effect. We talked about how students experience loneliness, isolation from their friends during those really important developmental years. But what about adults? What kind of impact has the pandemic had on them?
Absolutely. We see a trickle-down effect. It's funny because the work from home reality has some benefits, right? People can have more flexibility. And at the same time, I have clients coming into my practice who say, there's no barrier now between my home life and my work life. Or I'm feeling the effects of the pandemic now years later, and they're having, flashbacks of those kinds of moments. So, and these are people who are parenting and trying to live their lives. And so that's then impacting children. So I think the need is definitely not just among youth. The need is different depending on what developmental stage you're in and what your life includes.
And I can imagine specifically here in the Bay Area, so many parents, as we know, have to work because it's very expensive to live here. And raising children in the Bay Area is stressful. Finding the right education, all the stresses that the parents go through. I can imagine that you see it here definitely more.
Absolutely, yeah. I mean, we need so many services for parents and to support juggling so many different domains in life. And so we definitely see that in our practice. And that's one of the things that some mental health providers can really specialize in is supporting parents. And even having comprehensive services can be really helpful. So I have colleagues who specialize in working with families, and what that might look like is being in the school system or working with the parents at home, or these really kind of innovative and multi-tiered, multi-systemic ways of addressing mental health. And I think that's often most effective. And really partnering with community agencies. I think PAU is wonderful in how many practicum training settings we have. We have hundreds where our students can train in these settings that are specialized in those populations, but also that kind of get us out of the ivory tower and into the spaces that people are operating in. And that's often one of the barriers to receiving treatment, is actually just getting in the front door.
Sure, that's
so
so
if we can
important.
get to where they are, that really makes a difference.
All right, Dr. Sita Patel from Palo Alto University, thank you so much for
My
being
pleasure.
here. Great
Thank you.
information.